Hi, Mr. Brian.
Hello.
Hi, my name is Courtney. I'll be your nurse today. How are you?
Good.
Good. So we're going to be looking at your senses today. Your eyes, your ears, your nose, and your mouth.
Okay.
All right? Okay. So I have a few questions about your eyes before we begin testing. Have you had any injuries to your eyes?
No.
Any surgeries?
No.
Have you ever had your vision tested before?
Yes.
Okay. Have you had any problems with your vision, such as reading or seeing far away?
No.
Okay. And do you smoke?
No.
Alrighty. Usually we ask that because people who smoke tend to get cataracts or later develop glaucoma or macular degeneration. Okay?
All right.
And do any of those follow in your family history?
No.
Okay, good. So the first thing that we're going to do is we're going to test your visual acuity by using the Snellen chart. It's a series of letters, and what I'll have you do is cover each eye and read the lowest line that you can go.
Okay.
Okay? All right, let's go to the Snellen chart.
Okay.
Okay, so I have you 20 feet away from the Snellen chart. Can you go ahead and read with your right eye for me? So close your left.
DEFPOTEC.
Okay, close your right.
FELOPED.
Okay, so with the Snellen chart, what you read was... Okay, so you stood at 20 feet and read what the average person can read at 20 feet with line number 8 in your right eye. And then you stood at 20 feet and read what the average person can read at 25 feet with your left eye. And how we've determined that is by the chart. It designates a fraction for each of those lines. Okay, now we're going to do what's called the confrontation test. And this measures your peripheral vision, okay? So I'm going to have you close your left eye. And I'm going to cover my right eye.
Okay.
And when you tell me when you see my fingers, okay?
No. No.
All right. Opposite.
No. No.
All right. So we saw those basically at the same time. That means we've seen them at the same time, which is good. Okay.
Okay.
So now I'm going to look at your eyes. Your eyebrows are equal and symmetrical on both sides of your face. They're coarse and dark brown. They cover the temporal canthus. Your eyes, I don't see any discharge, redness, or bags underneath of them. Can I have you close your eyes for me? I'm going to fill up here and open them. So your eyes open and close widely. That's good. Whenever I palpated, I didn't feel any nodules, and there was no tremors.
Okay.
So now I'm going to look at the conjunctiva of your eye by pulling it lightly down, your lower eyelid lightly downwards, and I'm going to have you look up towards the ceiling.
Okay.
Good. So they're light pink. They are clear and free of any debris. I didn't notice anything in your eye there. The sclera is white. That's also really good. Usually if they're not white, they could be like a yellowish color, and that means maybe you have liver disease.
Okay.
So now we're going to look at your cornea, and I'm going to shine a light into your eye. Okay, so the cornea is a clear covering that covers your eye. It helps keep the external elements out of your eyes, keeps debris from going into your eyes, essentially. Okay. Next thing I'm going to do, we're going to use a cotton wisp here, and this is going to we're going to test your corneal sensitivity. I'm going to get close to your eye with it. Blink. Okay, so there was a blink that's positive. That is good because usually if we do not have a blink, that means that maybe the patient has what is called a herpes simplex infection. Okay. Looking around at your corneal arcus, I do not see any lipids around there deposited. Usually though, we'll see that in patients that are 60 years old or older.
Okay.
So next I'm going to look at your iris, and just at an initial glance, they are both hazel, symmetrical. I'm going to have the lights turned out. And look at your pupils here. And they are both round, reactive, and equal to light, which is good. They're about 4 to 5 millimeters in size. There was no nystagmus or shaky eye movements with that either.
Okay.
Okay. Next, I'm going to palpate around the inner edge of your eye here. You can keep your eyes open. Okay, there's no enlargement or inflammation, it looks like there. Usually, if there is, it may be caused by a tumor or there may be some other type of disease process.
Okay.
So now we're going to test the movement of your eye muscles, and there are 6 of those total, and then there are also 3 nerves that go along with the movement of your eyes. Those are the oculomotor, the trochlear, and the abducens. So how we're going to do that is we're going to do the 6 cardinal fields test.
Okay.
Okay. So I'm going to have you follow my finger, and I'm going to hold your head still for you because I want your eyes to follow. Good. All right. And now we're going to do the corneal light reflex. And how I'm going to do that is I'm going to use my pen light. I'm going to have you stare at an object over here. And I'm going to shine my light at you. All right. So that was testing the balance of your extraocular muscles in your eyes. They converged, which means that the light reflected symmetrically from both of your eyes.
Okay.
So now I'm going to look on the inside of your eyes using my ophthalmoscope, and how I'll do that is I'm going to have the lights turned off again. I'm going to look at each of your eyes one at a time. Alright, I need you to look straight or behind me here. Okay. So now I have a picture here, and it's going to help me explain this better to you, what I was looking at in your eyes. So we were looking at the lens here. The lens, we could see it. It was transparent. It's on the outside. It focuses the light into the pupil. Then I saw the red reflex, which is caused by the light going into your retina. I was then able to visualize the retina, which was a yellowish color, and there was no lesions that I could see. And what it does is it transmits objects into the brain. The next part that I was able to see was your blood vessels, and it was nice and vascular. It was all over inside, and you can see in the picture here, it's all nice and vascularized. Then I was able to see the optic, I really wasn't able to see your optic disc behind here, but here it shows you what it's supposed to look like. That is part of the optic nerve, and it's supposed to be like a yellowish color and about 1.5 millimeters in size.
Okay.
And also the next thing that I wasn't able to really see either was because I needed to dilate your eye was the macula or the fovea, which is the center of the visual field, and that really should have been, I needed to dilate your eye to properly see that as well.
Okay.
And then the very last, whenever I was pulling out and pulling back in with my ophthalmoscope on each of your eyes, I was trying to see the anterior chamber, and that is part of the conjunctiva and the sclera. Both of those are, I'm supposed to see the iris is totally lighted, which is what we were looking for.
Okay.
Okay, so we're going to move on. We're going to move on to your ears now. I'm looking at your auricles, or the outside earlobes here. Feel around. Any pain or tenderness?
No.
Okay, so they're the same color as the skin of the face. I don't see any lesions or cysts, any nodules, or any openings or deformities. They are firm and mobile. So that's good. I'm going to take a look inside of your ears with my otoscope now, okay?
Okay.
Move it up and around. And we'll look at the other ear. Okay. So I don't see any wax or cerumen in there. No discharge, no foreign bodies or any type of lesions. And it was light pink in color.
Okay.
Okay. And I also was able to visualize the tympanic membrane, and it's like a translucent gray color. You're actually able to see the umbo, the handle malleus, and the light reflex that was in there, and there was no perforations with that.
Okay.
You're appropriately responding to the questions I'm asking. Do you have any problems hearing at all?
No.
Okay. And we're going to use what is called the Weber and Rhine tests. And we're going to do the Weber first. It's going to test if you can hear it both on each ear. If not, then you probably have some type of occlusion, okay?
Okay.
At the top of your head.
Yes. Yes. Yes.
Okay. Good. And then the Rhine test was the one that I used in front of and behind your mastoid process on your ear, okay?
Okay.
Next we're going to do the whisper test. And how I'm going to do this is I'm going to have you close one of your ears. I'm going to whisper a series of numbers in one ear. Tell me afterwards what you hear.
Okay.
And I'm going to do the opposite for the other ear.
Okay.
So close your right ear.
T9, 8.
Correct. Now close your left ear.
8ZD.
Correct. So your ears look good. We're going to go on to your nose now. Have you had any surgeries or trauma to your nose before?
No.
Okay. Are you having any discharge from your nose?
No.
Do you have nosebleeds?
No.
All right. And any pain?
No.
Okay. So I'm going to palpate your nose here a little bit. Feel around. Nose is patent. There's no discharge or narrowing. The skin is smooth. It's the same color as the face here. There's no swelling. And I'm going to look at your nares. Your nares are symmetrical, oval in shape. And I don't notice any discharge coming from there. There was no bone or cartilage displacement or any masses.
Okay.
So next, I said the nares. The nares are patent there. I'm going to have you hold one side here and breathe in. Breathe in. Okay, they're nice and patent. Now I'm going to look inside of your nose. Look upwards for me. Alrighty. So nasal mucosa is nice and pink and glistening. There is hair present in your nostrils. There's no discharge. The tubernates are the same color and they're palish pink. There's no perforations, and the nasal septum is close to the midline and straight, which is where it should be.
Okay.
Okay. Now I'm going to look at your frontal and your maxillary sinuses by tapping here. Tell me if you feel any pain or tenderness. Good there?
Yes.
Good there?
Mm-hmm.
All right. So the nose looked good. Now we're going to move on to your mouth. Do you have any dental problems?
No.
Any sore throats?
No.
Do you wear dentures?
No.
Alrighty. Do you have any problems chewing?
No.
Okay. So, on initial glance, the lips, they're nice and symmetrical and pink on both sides. I don't see any lesions or chapping. I'm going to have you smile for me. Alright, your teeth, they're intact. And they occlude, which means the top meets the bottom. And that's the proper alignment for the teeth. I'm going to take a quick look here. Your gingiva are nice and pink. I don't see any lesions. Was it tender?
No.
Okay. Are you experiencing any tenderness in that area?
No.
Okay. And now I'm going to take a peek at your your tongue and the inside of the cheeks. So they're nice and pink and moist. I don't see any lesions there. And then I'm going to also test your cranial nerve number 12, which is the hypoglossal nerve. I need you to stick your tongue out at me. Good. Okay, so it doesn't deviate to one side or the other, and it's in the nice midline position. Next, I'm going to look at the back of your mouth. And I can see the uvula and the palate, and they come together in the back. They're nice and pink, and they are converged together. I also could see the tonsils. There was no enlargement, and they were pink as well, and I didn't see any signs of inflammation back there.
Okay.
I also was able to see the pharynx, and it was good as well. So now I'm going to test your gag response with my tongue depressor. All right, good. Alrighty. So it looks like we covered everything. The doctor will be in to see you in a few minutes. It was nice to meet you.
You too. Thank you.